I'm Dr. Stephanie Pinder-Amaker. I'm a psychologist who works with students, families, and schools, and I'm a senior advisor to the STEVE Fund. Welcome to this STEVE Fund Family Webinar. The college years, how families can support student of color mental health, was designed to help you support the mental health and emotional well-being of your student of color. And we created this webinar especially for family members, parents, grandparents, siblings, guardians, and any other member of the biological or found families who seek to support their young people as they navigate their college experience. When your young person of color is at college, it sometimes is hard for family members to understand what their student is actually going through and how best to support them, especially if they are struggling with mental health issues. This can be really challenging for parents and other loved ones who want to help and want to be an ally to their kids, but don't know exactly where to start. Research tells us that when youth encounter health issues, they primarily turn to their parents. And this means that parents and other family members have a critical role that they can play in helping their children to thrive. But the college years reveal a new relationship. Your young person is now a young adult and is often living, socializing, studying, and trying to navigate an environment that you aren't a part of. We all want your children to be successful and have great futures. And there are things you can actively do to support this. And we hope that after watching this webinar, you will be able to identify the stressors and challenges your students of color are facing at college and how these impact their mental health. Describe what mental health is, how it affects your student of color socially and academically. Create plans to help your student navigate the mental health system and access resources while at college, and to develop strategies for becoming an ally to your young person, reframing your relationship to maintain support and communication at this new time in their life. Joining me today are Dr. Farha Abbasi is an assistant professor in the Department of Psychiatry at Michigan State University who works in the Student Counseling Center and is core faculty member of the Muslim Studies program. Her areas of interest are cultural psychiatry and teaching medical students how to provide culturally appropriate care to Muslim patients. She recently served as a member of the STEVE Fund's National Crisis Response Task Force. Dr. Meeta Kumar was also on the STEVE Fund's task force and serves as one of their national advisors. She is a psychologist and also serves as the Director of Student Counseling at the University of Chicago. Dr. Andres Pumariega is professor and chief of child and adolescent psychiatry at the Department of Psychiatry, University of Florida. Dr. Pumariega does research in systems of care and cultural diversity in children's mental health and has presented as part of a series of convenings the STEVE Fund has held at universities across the country over the past 7 years. Dr. Abbasi, let's start with you. You work with students of color every day. What are some of the things families should know to better understand some of the stressors and challenges their students are facing?
Thank you, Stephanie. We know that this generation was already facing a lot of unprecedented challenges, and which has been exacerbated by overt racism, police brutality, and of course, the COVID-19 has just compounded this vulnerability. So we saw in recent survey that almost 60% spike in depression and anxiety, and that the college services, mental health services have been under demand, like the demand has gone 40–50% up. But what is really concerning is the suicide rate in student of color has gone up dramatically. That concerns me very much. What we need to know is that already when these students are going through these challenges, what kind of resources they have, what kind of support they have. And I think that's where the role of parents come in. We cannot just come in and tell them that, oh, we don't understand what's going on with you. We have to take a step back and understand that we are their support system. We have to be their friends. We have to be their allies. So depression and anxiety in minority settings might not come out like somebody wouldn't come out and say, I'm clinically depressed. It can affect their functioning, academic functioning, cognitions, relationships. They can, if they don't have healthy coping skills, they can go towards substance use. So all these are red flags, and we have to keep a lookout for them. But more importantly, to the parents, I just have to say one thing, that in the end, it is about your kids. And this is the age when they start the individuation process. They are trying to figure out who they are gonna be as an adult, from political, moral, ethical growth, from first time having relationships, making financial decisions. And this time is that we really need to support them. And support doesn't mean just giving advice. Support doesn't mean, sometimes support just means holding their hand and sitting with them and listening to them, actively listening to them. And in the end, it's never about what is wrong with you. It is what wrong is happening to you and how you are perceiving it, how you are coping with it.
Thank you. That's really helpful because you've helped us to understand that there are sort of expected stressors that all college students face, right, when they're transitioning to college or experiencing college, but that we need to understand some of the unique stressors that students of color are encountering on top of those anticipated stressors. It's very, very important. And then you brought up parents, and I'm glad you mentioned parents specifically, because according to surveys, most parents believe that any teenager can develop a mental health problem. But we also know that 2/3 of parents don't think their child will. And so this tells us that there's a real disconnect, right, between what parents expect will happen and what the real probability of occurrence is. The fact is, according to the World Health Organization College Mental Health Survey Initiative, that within 12 months of coming to campus, approximately 1/3 of students will screen positive for one of 6 common mental illnesses like depression or anxiety. Dr. Kumar, you run a counseling center at University of Chicago, and one of the things a lot of parents and family members struggle with is understanding what mental health is. Would you like to define mental health and share some basics with parents about how their college experiences affect mental health?
Absolutely. Thank you, Stephanie, and good to be with all of you. So when we talk about mental health, it's important to just understand sort of like a few basics. So mental health includes our inner experience of feelings, thoughts, and our behavior. It's our emotional, psychological, and social well-being. We all have a mental health, and it's important for everyone to know that mental health is affected by a complex composite of things like biological factors, genetics, brain chemistry, family history, life experiences, and it's also shaped by social, economic, and physical environments. Just like physical health, there are a range of mental health issues that people experience: minor and mild distress in response to situational stressors that cause little to no impairment, more chronic conditions like depression or anxiety. If treated or managed well, one can live a pretty functional life. And then there are serious mental illnesses that can be much more debilitating and life-threatening. Culture and context shape our views and beliefs about mental health, However, it's important to note that mental health problems are universal and can affect anyone regardless of intelligence, social class, income level, gender, race, ethnicity, or social orientation. These are not character flaws. Nobody chooses to be ill, and you cannot just snap out of it. There are many evidence based interventions that are effective and available to us today, and people can and do get better. And you mentioned, both of you, the mental health of college students. So we should all be concerned about the mental health and emotional wellness of our college students. And has already been mentioned by both of you, we have a lot of data that depicts increasing trends of stress, depression, and anxiety in college populations. As you just mentioned, Stephanie, while college can be a stressful time for all, students of color do experience some unique challenges. So I'll just highlight a few things here, which is the transition from high school to college can be particularly challenging. Students of color often struggle with finding a sense of belonging, adequate role models, mentors, faculty who reflect their experience. They may struggle with developing a supportive community. And then there are additional pressures to appear or be successful, navigate financial insecurity. So some of the most notable stressors, though, for college students of color are experiences of bias, negative stereotypes, prejudice, and racial discrimination or other kinds of discrimination. We also find in the last many years that witnessing national events of racially motivated violence can also have a vicarious impact. Feelings of anxiety, fear, being exposed to graphic images in constant news feeds can trigger trauma-like symptoms and feelings of feeling perpetually unsafe. So many of these experiences, to conclude, can create a sense of daily exhaustion, feeling overwhelmed, anxious, isolated, sleep difficulties, just daily disruptions in functioning, to more serious emotional mental health concerns that compromise student learning and well-being. So we know that mental health problems early in life affect outcomes in all areas of functioning later in life. And one of the key areas, which I hope we can address in our conversation today, is that consistently across studies, there are marked disparities in the area of seeking and receiving help. So data from several national studies show that college students of color with mental health difficulties overall do not seek or receive help like others.
Thank you. I just want to repeat something that you said. It's such a simple, straightforward sentence, but I think it cannot be said often enough that we all have mental health. And from what you're saying, it sounds like it is, basically all aspects of our lived experience influence our mental health, right?
Yes.
And I really appreciate that you mentioned the issue of vicarious trauma. It's so important that being exposed repeatedly to images of violence against people of color can take a toll on our mental health as well. I have a colleague who says, reminds us that to remember that breaking news is only breaking the very first time you see it. And after that, step away. I often say to college students of color, when you're watching the news and you hear the words that what you're about to see might be disturbing, that could be your clue to hit mute or walk away from the television. Thank you for that. As we know that while students of color have similar rates of mental illness and mental health challenges as other students, they are less likely to seek support than their white peers. Dr. Pumariega, I've heard you speak about the need to destigmatize mental health issues. What is stigma, and what can we do to understand and destigmatize mental health?
Uh, Thank you, Stephanie, for bringing this topic up. And Stigma ultimately is or are attributes that are seen as discrediting or reduced to bear from a whole person to a discounted person. And it's the word stigma literally means mark, so it's like a negative mark on the person. Um, and stigma is a very powerful social process. It involves many of the same factors that can lead to racism, like stereotyping, prejudice, discrimination, and many times disqualify people from full social citizenship. Um, Stigma is very much influenced by culture. I think Dr. Kumar mentioned that how culture shapes the perception of mental illness, and this is one of the most important ways that culture shapes that perception. Now, all cultures have stigma, and that stigma is based on the explanatory models that the traditional culture has for trying to understand mental processes and how those mental processes are affected or derailed. And many of those are common in our folklore and folk thinking, such as disfavor by deities, or belief of supernatural phenomena causing mental illness, or somehow having a bad seed in the family, or sometimes even beliefs like poor parenting leads to mental illness. Those are all common explanatory models that then reinforce stigma. Now, there are different types of stigma that people deal with. There's self-stigma, i.e. the shame of having a mental health problem, stigma that is felt by the family about having a member with mental illness, cultural and societal stigma, in which literally the whole population of people with a mental illness or a mental health problem are discounted or stigmatized, and even a stigma within the healthcare system. Mental health issues are stigmatized within our healthcare issue, and many times de-emphasized as opposed to where it's seen as physical health issues. There are many negative emotions associated with stigma, including shame, guilt. Shame that the person may feel, guilt about having the illness or bearing a burden on the family, projected blame about the illness, feeling of loss, and obviously fear of shame and fear of discrimination, margination, etc. And stigma can lead to many adverse consequences. Loss of family support is one of the most important ones if the young person withdraws from the family, but also peer support or sometimes loss of opportunity, but ultimately negative self-esteem. And the worst thing is that stigma can delay access to services. That when you deeply feel shame and stigma, you sometimes will delay accessing services, and sometimes that can lead to some of the disparities we see in students of color. They delay until things are more serious. Now, one of the factors amongst students of color is that, in a way, there's interaction between stigma and discrimination. And what many of our students of color feel who have mental health problems is they feel double stigmatized, sometimes triple stigmatized, if you add other factors like sexual orientation, for example. And they fear increased microaggressions. That there's also the imperative to be stoic, which many of our cultures have. Many of our BIPOC cultures emphasize stoicism as a way of coping with stressors, and that also includes immigrant populations and in many model minority groups, but also many students of color. There's the imperative also to strive for perfectionism, to strive for achievement, and that also gets in the way of being able to seek services and to accept the difficulties that one bears in experiencing mental health problems. I think an important article that I came across recently that I'd like to recommend in terms of the deep impact of stigma. And this is an example of somebody who has serious mental illness, but it still bears looking at, is a recent editorial by Dr. Daniel Paul in the New England Journal of Medicine titled "The Death of Daniel Prude." Daniel Prude was a young man who actually was killed as a result of police intervention when he was experiencing an acute mental health episode. And it turns out that Dr. Paul, who was a neurosurgeon in the same town, was related to Daniel Prude, but never knew of his illness because of the stigma in the family. And he was able to see the connection between the stigma that was pervaded in the family, where they didn't talk about the illness, and the stigma in the healthcare system and the law enforcement system that kept them from providing effective care. So I really commend that to families to read, and that's a very powerful testimony. Now, there are some good news about this. Stigma can be, you can combat stigma with information, with fact, with education and support. If families can demonstrate acceptance for the young person and acceptance that their mental health problems doesn't define them, they can be responsive to treatment, encourage them to seek help and support. I think that is extremely important. That's the most critical piece, so they don't feel like the family has shunned them. Also, access to services. And one of the important things we found out here at the University of Florida, looking at our data from the Healthy Mind Study, is that students of color tend to access on-campus mental health resources more than off-campus, or even resources back in their home communities. And what that does is actually they feel more safety, they feel more privacy going to campus services than going to the local community mental health center, or even the local services back in their home community. And I think it's supporting students in accessing those services is extremely important. It's an extremely important way of combating stigma, along with their becoming involved with support groups of students of color.
I think it's so helpful to understand that stigma is actually a really complex construct and with a lot of definitions. But it's important to understand sort of the differences between self-stigma and perceived stigma if you're going to truly intervene most effectively to eliminate stigma as experienced by our students of color. Dr. Abbasi, you specialize in work with Muslim students and mental health for students of different faiths. Can you illuminate some of the specific issues that affect Muslim students, both domestic students and international students?
Yes, definitely, Stephanie. So I would like to add to the previous comments, and then talk about Muslim students.
Sure.
One thing we see with stigma is the silence and the shame, the need to hide things. And I always talk about that visibility can be viability. So once they get to a point of accepting that yes, I am struggling, then comes the other aspect of the trust deficit, that the fact that they feel more comfortable accessing care on campus settings versus going to their communities. I think it's like the campuses, especially at Michigan State, what I'm seeing, we are making such an effort to provide culturally sensitive and racially responsive care. So I think this trust building is very important to encourage students. And of course, another way to see that trust or solidify that trust is when they see people like them working in these settings. So it's important to have a very diverse workforce to create this trust with the students of color. Another thing we see, of course, is where is this trust deficit coming for students of color or religious communities, especially Muslim students, because we know that they are being targeted, they are under surveillance, and they have to deal with those extra issues. So Muslim students, of course, like other students of color and faith, first of all, they have to accept the fact that mental illness is not a spiritual failure. It's not a moral, ethical failing. So they have to come to terms with that. And then the biggest problem becomes conveying it to their parents and family. And because the combined shame of the family encourages them that even if they are suffering, to seek care somewhere very quietly, and so that rest of the community doesn't get to know about it, because the model minority myth of your children are trophies. They are not, they are reflective of your success. So if your children are struggling, then it's your personal failure as a parent. We need to that's why when I started working in the community, I had to do three-way intervention. One thing was helping students come to terms with their mental health concerns, fight their personal stigma, but then I had to talk to the parents to accept the fact that it's when I say 1 in 4 students struggling with depression, that includes your Muslim kids as well. And the third piece was, of course, these kids, if you are from a faith-based community, validation from a faith leader becomes very, very integral to your well-being and wellness. To be accepted by a faith leader, I think can be a very defining moment. So then, of course, the third part was training the faith leaders, teaching them to have these conversations.
That's really powerful. A three-way intervention I think, just exemplifies what a concerted effort it takes to really address barriers to treatment and to eliminate stigma as one of those barriers. Thank you. Dr. Kumar, let's come back to you. Family members of college students have a range of needs. Some have students with significant mental health issues, and others may encounter some of the stressors and challenges we've outlined already. And these can cause distress for students who need some extra support. What do you think parents can do specifically to help their students navigate the mental health system on their campus?
Yeah, and I can't emphasize this enough that the support of family can go such a long way in helping the student just deal with their challenges and move on the path towards success. And we all want that. So just a couple things before we get to navigating the college systems.
Sure.
As parents and family members, you sometimes are in a unique position to notice when a student may be experiencing distress. You may see outward changes in behavior, expressions of distress, and I think those are really important to be attentive to. We have lots of evidence to know that students do think of their parents and families as important sources of support and often share their difficulties with them. So a couple of just practical strategies. Take the concerns of your students seriously. Just validating their experience will help them feel supported, deepen your understanding of their concerns, and strengthen the relationship. I hear parents say very often, my child doesn't tell me much. And I always say, sometimes as parents, the more we listen, the more likely they are to open up to us. And that emotional support is critically important and one of the best ways you can help. The other is to really encourage your students to reach out and ask for help. So these days, there are a number of resources on college campuses to support students, like counseling centers, and I'll share more in a minute, students of concern teams, residential life staff, faith and religious centers, Office for Diversity and Inclusion, deans of students, so all kinds of resources. And many of them have very diverse staff and really incorporate very culturally congruent practices. So college counseling centers are serving thousands of students each year coming in for a range of concerns, from academic stress to social struggles, identity concerns, to more serious issues like anxiety, depression, and other mental health concerns. So connecting your student to any of these resources, I always say, doesn't matter where they start, just getting them connected, reducing their isolation, that may be just a really important first step to getting them the help that they need. If you're looking out for campus counseling centers specifically, please look up the websites to learn more about the services. There's great variation in services provided across college campuses. And it's really good to just understand what your campus offers. And that can also be a really great step. And at counseling centers, typically the process involves just talking to the student, understanding their concerns, and then developing appropriate care plans to support the unique needs of each college student.
Thank you. I'm hearing sort of a thread that's running through everything that you're saying, and you're providing such practical guidelines and steps that parents can take. And by having the information and taking these steps, sounds like you're really trying to empower parents and to lean into, embrace the influence and the role that they have to really make a difference in the lives of their students relative to all of these issues. Thank you so much. We know that this can be a hard time for parents, a time full of changing dynamics. Not only is the student experiencing and adjusting and learning, adjusting to and learning how to be in a new space, a new opportunity, but so are parents. And so I want to use the last part of this webinar to ask each of you to share your thoughts on other things that parents can do to change their relationship with their student and better support the student's mental health and well-being now that they're in college. Dr. Pumariega, let's start with you.
I think as I was mentioning previously, open, frank discussion and acceptance by parents and validation of the mental health issues the young person may be having, as well as helping them understand that seeking help is not a mark of shame, but also that at certain times that's the higher priority, even to academic success. That in fact, receiving good services and good supports is the platform for being able to be successful academically. Sometimes youngsters push themselves and ignore their distress and it may end up backfiring. So establishing that regular communication and that regular discussion. Now, you certainly want to respect the young person's autonomy and coach them on how to seek out these various services, for example, that Dr. Kumar mentioned. However, being able to receive information from the services is actually encounter some barriers, actually some legal barriers around privacy laws. There's a set of privacy laws around clinical issues, which are called HIPAA, as an acronym, and which apply to all health services, and then the other one's called FERPA, which is around educational information. It's important to note, though, that for the very concerned parent who believes that their young person is experiencing high levels of distress, neither of those legal restrictions prevent them from reaching out to those services and giving information and sharing their concern about the young person.
Right.
And the college services, many times, based on parental report, will reach out to the young person and establish the connection. So I think that's extremely important. But you certainly want to give the young person the first opportunity and even let them know that you're going to be doing that you're that concerned, that you care for them, and that you certainly want to support their seeking help themselves, but you want to facilitate it. I think also, as I mentioned before, there are legal requirements for many of these services. For example, around academic supports, they're the same legal requirements in college as there are in high schools and middle schools and elementary schools, i.e., laws around disabilities, which involve both mental health issues and educational issues like learning disabilities, and even academic supports can be accessed much in the same way in the college environment. Some of those can reduce significant anxiety that the young person may have, and also encouraging the young person to connect with support groups from their particular ethnic, racial background. So they don't feel isolated, so they establish connections. I think that's something else that parents can support and encourage.
Okay, so helpful to just remind parents that yes, there are certain legal barriers well known among institutions of higher education, but those barriers do not prevent parents from communicating one way to the many resources and offices available, as was mentioned earlier by Dr. Kumar. Thank you. Dr. Abbasi.
I think we have to understand few parameters of our academic life. First thing is that college is not a sprint, it's a marathon. So not everyone would do it in 3 years, 4 years. Some kids might need more time. And I think another piece I see is the concept of what is success. When we look at it from kids who are struggling with mental health concerns or depression or anxiety, for them, maybe success cannot be defined in a GPA number. Success could be showing up for classes. Success could be keeping one safe. Success could be keeping one socially engaged, you know. So we
Sure.
have to step away that our well-being of our student cannot just be reflected by their GPA scores. That's why I feel the policies, we still look at the lens from the lens of equality, not equity. Not every kid has the same pace, will not grow in the same way, or will adjust to college life in the same way, or, you know, will be right away scoring high GPAs. And that's the piece not only parents have to understand, but I also work with academicians and college professors to understand that. That said and done, I think important piece again is that for the parents, as much as it's an individuation process for the children to become this adult, but we as parents know they are like half-baked adults, right? They are on surface, they become adults, but they still have that vulnerability. And for the longest, we have been the official protectors of them and moral authority on them. And it is very hard struggle for parents to let go and cut that umbilical cord and give that space to their kids to grow and be who they want to be. I think I see a lot of struggle there. Parents want have these expectations that they are gonna just grow into this person, go to this career, and will do this. You have to step back and understand it is no more. You have done a good job. You made sure they have good values. Now you have to trust your training. You don't have to be the helicopter and just sure every day. You have to trust it and give them that space to grow. They will make mistakes. We did. We don't want to acknowledge it, but we we did. We learned, and it's not ever going to happen that, oh, learn from my mistakes. No, they will falter, they will make mistake, but what we need to ensure is they don't fall and they continue to walk through this journey. And that's where the supportive parent comes in. That I think the biggest challenge for this generation already is social isolation. They are very media connected, but not on a personal level, and so much more important to have that support system around them, be it family, peers, friends, support groups, but also the academic staff has to be their support, has to be there and ally. So I think that's my message to the parents, that it is hard, but it is time to step back and be that friend, that ally, and let them make mistakes, but just be sure that you are there to help them stand up again.
Thank you. So you're officially granting parents permission to step back into the. Okay. Thank you, Dr. Kumar.
Yeah. So just sort of a couple quick thoughts. I think both Dr. Pumariega and Dr. Abbasi have provided pretty powerful messages here. And I do think ultimately, you know, as parents who want good things for their student, another way to frame that is that as students are becoming young adults and moving on, they're accruing new perspectives and experiences that are important to them. And attempting to understand those actually really helps to create stronger trust. We know, I guess, through this conversation and also just the data that mental and emotional concerns are just very real in the lives of college students. So, taking them seriously, I think, is important. We're all in this together to really support the student. And lastly, I think our students of color are often among the most affected, at risk, and not getting the help that they need. And that really should be, I think, something that affects all of us. And lastly, we know that when students utilize help early, they have better retention, ability to persevere through difficulties in college. And these are just really healthy life skills that we are all trying to promote. So I would really invite the parents and family members to be part of this journey, because we are in this together, and we all have a responsibility to equip our young people to go on and thrive and be successful in their lives. So let's all be part of the solution.
You have all given such practical guidelines for parents and parental figures, like specific things that they can do. And I hear lots of validation for the fact that, there's a transition for parents it's different being the parent of a college student than it is being a parent of a high school student. So thank you for that validation, and even more, thank you for helping parents to know what they can do that's appropriate and helpful in reducing stigma and promoting the mental health of their students of color. So I want to thank you all for listening today, and thank you so much to my colleagues, Dr. Farha Abbasi, Dr. Meeta Kumar, Dr. Andres Pumariega. It's been a wonderful conversation, so empowering. For more information and to find the resources for your family to support the mental health and emotional well-being of your student, please visit stevefund.org. We wish you and your family all of the best and invite you to become part of the Steve Fund family as we work together to promote mental health and emotional wellness of our students of color. I'm Dr. Stephanie Pinder-Amaker. Thank you.